Well, my friends, in this video, I do like to demonstrate about the urinary bladder and the bladder tumor. This gentleman, aged man, is about 76 years, has been suffering from urinary bladder tumor, for which he had operated twice. This blood history of hematuria, diagnosed as bladder CA, and twice operated. After 2 times operation, the tumor relapsed because the tendency of the tumor is to frequent come up. Many patients become frustrated, annoyed, and come to us for any permanent solution we are having or not. The patient is better to me by homeopathic treatment. Now, what is bladder and the bladder tumor? You know, my friends, this is a picture of urinary bladder. This is a picture of urinary bladder. The urinary bladder is a hollow muscular organ which functions as the temporary reservoir for the urine received from the 2 kidneys and to discharge it out periodically, time to time. The empty bladder looks like a 4-sided pyramid because it has 4 angles. So, urinary bladder tumor. Now, there are many diseases are unrelated with the bladder. There may be urinary incontinence, there may be Wilms tumor, there may be obstructions of the outflow of urine, there may be UTI or urinary tract infection, etc. Now, the tumors are very important in the senile age, in advanced age. There is wide variation of tumors in the rates of progression and recurrence of the tumors. The tumors broadly may be divided into 2 groups, like other tumors of the different parts of the body. One variety is benign, the other variety is malignant. The benign tumors of the urinary bladder is called benign papilloma or only papilloma. But the malignant tumors are called transitional cell epithelial carcinoma or papillary carcinoma. The carcinoma of the bladder or cancer or malignancy of the bladder is common and occurs more frequently in males than the females. There is high incidence of the tumor in workers in the rubber and dye industries. রঙের কারখানায় যারা কাজ করে তাদের সম্ভাবনাটা বেশি থাকে। The more malignant and solid tumors tend to rapidly invade the bladder wall and spread in lymph and blood vessels and goes from one part of the bladder to the other parts and neighboring organs. And thus the tumor becomes ulcerates and there is hemorrhage and necrosis. Smoking cigarette or bidi is also predisposes to the development of bladder tumors. Typically, the main symptom or a patient comes with painless hematuria. ব্যথা নেই কিন্তু প্রস্রাবের সাথে রক্ত পড়ছে. Occasionally, in advanced disease causes loin pain, কোমরে ব্যথা হতে পারে due to obstruction of a ureter and hydronephrosis or acute anuric renal failure if both the ureters are obstructed. Diagnosis, of course, is made up by IVU, which shows a filling defect in the bladder, and of course by the modern instrument cystoscopy. So this is the bladder tumor. In short, I have a tendency or desire to demonstrate about the disease conditions with all of my videos. So the tumors of the urinary bladder may be benign and malignant. Benign tumors are known as papilloma and malignant are known as papillary carcinoma. কাদের বেশি হয় বলেছি যারা অ্যানিলিন ডাই বা রঙের কারখানায় কাজ করে, যেমন ন্যাপথালিন ফ্যাক্টরিতে কাজ করে, এইসব কেমিক্যাল নিয়ে যারা নাড়াচাড়া করে এবং সিগারেট স্মোকিং যারা বেশি করে তাদের এই রোগের সম্ভাবনা বেশি থাকে। ইট ইজ কমন ইন অ্যানিলিন ডাই ওয়ার্কার্স, ন্যাপথালাইন ওয়ার্কার্স, কারণ the intermediate products of these chemicals are absorbed through the skin, lungs, mouth, etc. and goes into the blood. And while passing through the urine, it passes through the kidney, enters into the ureter, and while goes into the bladder, the poisonous chemical end products may deposit into the bladder and form the malignant tumor. So bladder tumors are very dangerous. Certain aminophenols are excreted in normal urine. They are conjugated with the chemicals and form tumor. Cigarette smoking exerts a profound effect of tryptophan metabolism, probably blocking the metabolic conversion of antholinic acid. So this is about our bladder carcinoma or bladder tumor. Now the question arises, is the bladder tumor is possible to treat in homeopathy? The malignant tumors are grow fast, spread fast, and very difficult to control, my friends. You see, this is the example of the gentleman who twice operated but relapsed again. I have seen other patients 3 times, 4 times operated, but the tumor was reappeared. However, the gentleman is still okay. I have given the medicines at first T occidentalis, followed by one antisoric, and again followed by T occidentalis, and lastly causticum, according to similarity and the change of plan of treatment method when the patient demanded by his symptomatology. Is there any improvement? Yes. The bleeding stopped or sometimes recurring very in a small quantity or scanty form, and the tumor is obviously improved. This is the report of when the patient came January. This is the month April. In January 2025, the largest tumor, there are many tumors, the largest size was 40 into 27 millimeter. See, the largest one measuring 40 into 27 millimeter, dated January 2025. So January 2025, size 40 into 27 millimeter. Now this is at April, 2nd April, the size reduced into 29 into 27 millimeter. So 40 into 27 to 29 into 27 millimeter. No doubt the patient is in the way of improvement. And my medicine, which the last medicine which I given, which is still acting into the systems of the patient, is causticum, and I do like to continue this medicine, anti-miasmatic, deep acting medicine, causticum. It should be continued. So my next prescription is causticum in next higher potencies. Let's see the result. I shall share you once again, my friends. So let's prescribe causticum. I am sorry. I have shown the name of the medicines of other patients. This is the bladder CA patient, and this patient only required only single medicine, T occidentalis. There are some other case takings in the table, on the table, and while demonstrating, I have mistakenly shown the medicines of another patient. This patient required only single medicine, T occidentalis, starting from 0/1 and continuing the same medicine, and this has written January, the size was 40 into 27, April 29 into 27, and the last potency was T occidentalis 22, 23, 24, 25, 26, and let's today prescribe 20 from 27. Once daily morning. So let's please remember this video. I shall share you this video, share you the case of this patient once again after 3 months. এমনি ভালো আছে, মাঝে মধ্যে একটু ব্লিডিং হচ্ছে, এইটা বক্তব্য। হ্যাঁ।